Have you ever woken up in cold sweats because of a nightmare over and over again? Your pupils dilate, your muscles tense, and the sleepiness you felt dissipates instantly.
If you're anything like me, stress has been your uninvited roommate since day one. Over these 2 years, I've dug into tons of studies, watched countless YouTube videos, and even hunted down expert interviews, all to figure out how to handle anxiety better. So, if you clicked on this video, chances are you're battling the same stress monster I've been fighting. So stick around till the end, and I'll share my absolute go-to trick for those moments when stress feels overwhelming. So let's dive in. A 1987 study shows that people with post-trauma who lived in extremely stressful environment might experience repeated haunting dreams. Dr. Deidre Barrett, clinical professor of psychology at Cambridge Health Alliance and the author of the book Trauma and Dreams, says your amygdala and other regions of your brain that is in charge of fearful behavior might be overreacting and overly sensitive when you undergo stress and anxiety, especially for PTSD patients. Their amygdala's ability to detect potential threats are way too sensitive and could possibly result in series of anxiety dreams. So, how can you stop having tons and tons and tons of nightmares?
The best way, if you're having a lot of anxiety dreams that you don't want and seem to be making you more anxious, the best technique is to choose what dream you would like to have. Just think of your ideal dream to have tonight.
As Dr. Deidre Barrett has said, think about the dreams before you go to sleep. Maybe your dream is visiting someone you're not getting to see in real life, or traveling to a beautiful place that you wish to be, and the list goes on. The point here is to imagine your dreams as you're falling asleep. Tell yourself, I want to dream about this, and try to form a picture in your head.
This worked about 50% of the time. It's not foolproof, but it definitely makes it likelier you'll dream on that topic, and even likelier that you won't have the anxiety dreams.
Sleep duration can also indicate stress level. For example, this study tracked 32 participants' sleep patterns and found that the patient group, people with post-trauma and higher stress, slept significantly less, on average, than the control group. Lack of sleep doesn't just reflect stress. It can also trigger issues that disrupt daily life, such as mood swing and low motivation. Most critically, it raises what's called allostatic load. This term refers to a hidden measure of strain on the body that builds up during stressful situations. For example, it could spike after severe trauma, like losing a loved one in an accident, or accumulate gradually from everyday stressors like chronic sleep deprivation, and anything in between. Think of a cup as your day, and the water inside of that cup is your allostatic load. The fuller it gets, the more stressed or exhausted you feel. When you face psychological stress, that load rises. Small increases might not seem noticeable at first, but if you push past what the cup can hold, the load spills over into the next day. This buildup and the overflow is what leaves you drained day after day. Now that we've covered stress, dreams, and allostatic load, how do we actually reduce stress? The first one being, start by pausing what you're doing. Scrolling through social media or binge watching endless videos, those habits tanks your mental health and spikes stress. A 2024 study found out that screen time is directly correlated with higher stress, anxiety, and depression. So trim it down and you'll feel the difference day after day. But I know some of you will say, okay, sure. We all know scrolling through social media messes with your mental health. But give me something practical, something I can actually use today to, reduce stress and do all of the other things and increase my, productivity. So now I'll give you something that you can actually work on. This is called the physiological sigh, and here's how it works. So start with a big, deep inhale through your nose. When you do this, your diaphragm drops down, which creates more space around your heart. And that extra space actually slows your blood flow for a second. Now, here's the key part. Right after that first inhale, sneak in a quick, tiny sip of air. You know? Like you're topping off a balloon, and that second breath fills up those tiny air sacs in your lungs. Then, let it all go with a slow, controlled exhale through your mouth. Like you're blowing out a candle slowly. This long exhale flushes out carbon dioxide, which is like hitting a reset button on your stress. Your brain picks up on this and flips on your parasympathetic nervous system, also known as your body's chill out mode, bringing up the heart rate and dialing down the tension. Super simple, science-backed, and you can do it right now. Snap a screenshot of this, write it down, or just memorize it. Do whatever clicks for you. This is my daily go-to whenever I'm overwhelmed, and trust me, it works. Reducing stress isn't a one-size-fits-all thing. We've talked about the physiological sigh, cutting screen time, but there's so much more out there. Meeting up with friends, laughter over coffee, these works magically. Or just move your body, like take a walk. Dancing in your pajamas, whatever shakes off the tension. The small steps adds up. Your allostatic load is not about perfection, okay? It's about finding what clicks for you. Trust what we've covered today, but also trust yourself. Breathe, tweak your habits, and take it one day at a time. If this video helps, please help me smash that like button. It seriously makes a difference for this channel. And if you're not already subscribed, hit that subscribe button so you don't miss out the next video. Thanks for hanging out. I'm Ian, and I'll catch you on the next one. It raises what's called allostatic load. Small increases might not seem noticeable at first, but if you push past what the cup can hold, but if you push